can you talk about your study that you presented at ESC on Yale's cardiac complications registry? What do you consider to be the most important finding?
So first of all, in brief, this is an ongoing retrospective and prospective registry that is collecting information on all adult patients who were either admitted to or transferred to Yale New Haven Hospital with a positive SARS-CoV-2 test. The hospital has two main resources that aid in providing customized reporting and data analysis from our EMR. And we assembled a group of residents that obtained study data through manual chart review. And we collected data related to pre-existing cardiovascular disease, cardiovascular risk factors, medications, clinical presentation, laboratory findings, and clinical course. And I would say that we have three main findings. One, we found very high prevalences of cardiovascular risk factors and cardiovascular disease in patients who were hospitalized with COVID-19. For example, more than 40% had hypertension, hyperlipidemia, and diabetes respectively. And almost half, that's 46% of individuals, had a history of cardiovascular disease, most commonly coronary disease, heart failure, and atrial fibrillation. Number two, almost 1 in 5 died in the hospital. That's excluding patients who were discharged to hospice. Almost 2 in 5 experienced a composite cardiovascular event. 1 in 3 were admitted to the intensive care unit, and 1 in 4 required mechanical ventilation. So significant comorbidity in these patients, morbidity during hospitalization. And then 3, which I guess is the most interesting finding, that pre-existing cardiovascular disease, male sex, older age, signs of respiratory failure at admission, and a number of biomarker abnormalities. I'd say from a cardiovascular standpoint, the most interesting one was higher troponin concentration. These were all independently and significantly associated with poor outcomes.
What should a clinician or healthcare provider, especially when treating COVID-19 or a patient with COVID-19, what should they take away from this data?
So hospitalized patients with COVID-19 are patients with a significant comorbidity burden. And we think it's really important to optimize cardiovascular treatments in this group of patients, honestly, irrespective of whether they're admitted with COVID-19 or not. But it's very easy to make the mistake of solely focusing on the virus and attributing all signs and symptoms that these patients develop to a severe COVID-19 course. But the very high cardiovascular complication rate found in our study suggests that we have to be more vigilant in detecting and possibly treating these complications. I think that's one of the very important points.